I'm Jackson County Executive Frank White Jr., and I'd like to welcome you to my 2021 State of the County. I'd like to begin by thanking the Girl Scouts for leading us in the Pledge of Allegiance. I was honored to issue a proclamation recently recognizing International Day of the Girl and the leadership demonstrated by the Girl Scouts throughout our community. They remind us what is great about Jackson County and give us all faith that our best is yet to come. Before moving any further, I would also like to thank my friends and my family for their love and support. I especially want to thank my best friend and partner and amazing wife, Teresa, for everything she has brought into my life. I wake up every day knowing that everything will be all right as long as we're together, and for that, I could not be any more grateful. Normally, I would be delivering this message on a stage in front of a crowd that would include an audience of public officials, members of my administration, community leaders, and residents of Jackson County. But these are no normal times. As you can see, it's just me coming to you totally virtual. I do so because of the threat that we continue to face in this deadly pandemic. But more importantly, as a symbol that we can and must move forward, even if it's not exactly in the same way as it once was. We have endured so much over the past 2 years. An unfamiliar virus showed up in our community and changed our lives forever. We had to stay home. We had to socially distance, and we had to wear masks. Many of us got sick from COVID-19 and survived. The people we simply called doctors, nurses, and medical technicians quickly became heroes. They couldn't stay home. They couldn't wait for a vaccine. They couldn't escape the risk. But they did what heroes do. They stepped up. They followed the science and took care of us. They saved lives. For this, we are eternally grateful. Despite their best efforts, many lives could not be saved. Hundreds of family, friends, and neighbors have died far too soon in Jackson County, including members of our own team. Robert Bobby Mitchell served for 16 years as an electrician. A father of 3, his family was his passion, especially his 2 grandsons. He loved adventure, riding his Harley across the country to all 50 states. And he fulfilled his dream of spending a month in Australia. He was 56 years old. Lois Purvis died in late October 2021 due to complications from COVID-19. Since 1995, she served as a legal assistant in the prosecuting attorney's office. Over those decades, she became an essential and trusted member of the team, more like family than a colleague. Lois had so much life to live and love to give. She would be deeply missed by her family and friends. Joellen Engelbart served more than 5 years as an assistant prosecutor. She had a passion for public service and protecting those who were most vulnerable. Her life was just beginning. She was pregnant, excited to start a family with her husband. Joellen's son was delivered premature in December, just 4 days before she passed away. She was only 32 years old. COVID-19 has caused so much unbearable pain and suffering. Those feelings may diminish over time, but they will never go away. For Scripture tells us there is purpose in our pain. Jeremiah 29:11 says, "For I know the plan I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future. We can use our hurt and heartache to create hope and use that hope to build a future we can all be proud of. We owe it to the families of Bobby, Joellen, and Lois, and to the loved ones of all COVID victims to come together and make our community better for all. We can do so in honor of all those we have lost. We can do so in honor of our healthcare heroes and the many generations yet to come. So today, I'm asking you to join me in building a better, more equitable Jackson County. A better Jackson County is focused on improving the customer experience, supporting our most valuable resource, our associates, and doing so in a fiscally responsible way. A more equitable Jackson County ensures that we're drawing on the talents and diversity of our residents. Our policies are inclusive, and our programs are accessible to all, no matter what zip code you call home. That's building a better, more equitable Jackson County. Former First Lady Eleanor Roosevelt once said, "Government exists for one purpose, to make things better for all people." She's absolutely right. In good times and bad, that's how government is supposed to work. When the pandemic hit, we had no idea how we would weather the storm to make things better for all people. How would our kids learn with schools closed? How would parents put food on the table and pay the bills being out of work? How would our health department and safety net hospitals get the tools they need to keep us safe from the virus? These urgent needs were addressed thanks to good government. The county received more than $122 million in federal funding under the CARES Act. And in partnership with members of the Jackson County Legislature, I'm proud to say that we made smart choices to successfully ensure that every single dollar we used to provide essential services and relief to those facing unexpected hardships caused by the pandemic. We supported our K-12 public schools in Jackson County with $5 million to help enhance wireless internet services, improve education technology, and conduct COVID-19 testing. We provided $40 million to cities throughout Jackson County to ensure that essential services like firefighters and police would be there when our residents needed them. We supported efforts to combat hunger, allocating nearly $2 million to help food agencies purchase and distribute food and other necessities to residents. We supported keeping families in their homes with our $11.5 million Emergency Rental Assistance Program. With the expertise of our valued partners, Community Service League and United Way of Greater Kansas City, the county prevented more than 1,500 evictions by helping families pay current and past due rent, as well as utility bills. The average household received nearly $4,000 in assistance. And I'm happy to say our efforts will continue. The county legislature recently approved an additional $6.2 million to ensure families remain safe, housed, and healthy in the midst of the pandemic. We all want to be safe in our homes and our communities, and we all want the best for our children and to be able to live as long as possible. That is why it hurts me so much to know that members of our community face different realities based purely on where they live. A child born in the 64128 zip code on the east side of Kansas City has a life expectancy nearly 20 years shorter than a child born in the 64113 zip code in the same city, less than a mile apart. I am that child, but for the grace of God, I could be that statistic. I'm a proud product of Kansas City's East Side. I went to school on the East Side, found my love for baseball on the East Side. But as I got older, I realized that the racial divide and segregation on the East Side had a devastating impact on the kids and families I grew up with. Not being able to afford prescription medications or little to no access to preventive health screenings. Colon cancer is one of the most preventable and treatable cancers, but it claims so many lives. My parents, Frank and Daisy White, both died from colon cancer. And I truly believe that if they had had access to screenings, they would have had a fighting chance to survive. These personal experiences and health disparities still exist on the east side of Kansas City to this day. But it is my promise to do everything I can to give our most socially vulnerable communities a fighting chance at a good quality of life during COVID-19 and beyond. That's why I'm so proud that we invested nearly $5 million in the Our Healthy KC East Side program, led by UMKC, University Health Truman Medical Centers, and Children's Mercy. This program brings together dozens of community organizations to specifically address healthcare inequities and disparities in our urban communities. Through COVID-19 outreach, education and vaccination, as well as better access to preventive health services, the program is empowering residents to take control of their well-being. To tell you how we're getting the work done, here are two of our key partners, Dr. Jeanette Berkeley-Patton and the Reverend Eric Williams.
Part of the infrastructure that we have under these four community sectors, under businesses, neighborhood associations, faith-based organizations, and youth organizations, is each of those sectors have 15 organizations. So we have nearly 60 organizations who have been a part of coordinating these vaccination and health services events.
There's a little store called Wild Woody's that's in the hood, and they did a bang-up job with having hundreds of people come to take vaccines and surveys. And so there's kind of a creative little competition that we've got going between churches and Wild Woody's.
We have exceeded our goal of vaccinating 5,000 people.
And even young people who feel like they're invincible. It's interesting and wonderful watching them gradually come around.
And he was probably only about 18 or 19 years old. And he said, I have several concerns about the vaccine, about how fast it was, developed. And, I've heard all of these rumors about it. And so because at our vaccination events, we have physicians there, we have pharmacists there, I was able to take them over to our lead pharmacist, and they sat and talked probably for about a good 10, 15 minutes. And then he came back and he was like, I'm ready to get vaccinated. And I think that's the power of being able to have these services readily available in the community.
The big elephant in the room is trust. Do I trust you? Do I trust that the information that you're given is right? Do I trust that the vaccine's not gonna make my head swell up? We've been able to knock down some of the conspiracies and help people trust. People think that we should be spreading the gospel. It's hard spreading gospel to dead folks. We need people to be alive, active, moving, prosperous. One of our go-to passages is the text that says, Beloved, I wish above all things that you prosper and be in good health, even as your soul prospers.
We know that during the pandemic, many people didn't get their annual wellness exams. And then we know from this community in particular, there are a lot of people who would never get them anyway. And so this, again, provided them with that opportunity. We had one woman who came and she was like, I'm fully vaccinated. I just showed up because I needed to get my blood glucose checked today. And she was able to do that. What I've learned in getting a chance to know the county executive and his team is that They are really concerned about the health of Kansas City's East Side. It was really clear to me that there was a sincere, heartfelt effort and desire to really be able to address health in an innovative way.
Well, I think this is one of those have-tos. There are just times when you have to. You have to do it, but you don't have the political will to do it. That stops some people. But to see, number one, his will, and then the unanimous vote of the legislators, I'm like, wow. I am bursting at the seams for the possibilities of this, and the collaboration and the new friends and the army of folks that are on our team to fight this battle is just significant.
We really want the community to drive what the next focus of this project, this initiative will be. That was the vision for the Jackson County executive, not just to address COVID-19, but to use this as a springboard to address many of the other health disparities in our community. I can say personally, I would really love to focus on diabetes. And we know that for the most part, African Americans, Latinos, people of low income are at higher risk for diabetes. And there are so many opportunities for us to be able to address pre-diabetes before it moves into the diabetes range.
I'm not sure if this kind of cooperation is happening in other cities around the country, but I just pray that we can expand it, that we can keep the groups together, that we can work on all these things that'll make us healthier.
Having been born and raised in Kansas City and growing up in Kansas City's East Side, this project has just really been like near and dear to my heart. To be able to do this work on the East Side and to have the impact in vaccinating thousands, it's just been a really personal, it doesn't get any better than this.
The county has never done anything like this before. In fact, I was told it couldn't be done. But we did it, thanks in large part to the leadership of legislator Ron Finley and with the unanimous support of the legislature. I was recently inspired by Legislator Finley's call to turn this program into a long-term priority and make it a central tenet of what Jackson County is and what we do. I'm excited to announce our plans to do just that. I'm proposing a 3-year, $10 million extension to the Our Healthy KC Eastside program. This will allow our partners to use the research they have gathered from residents and provide the resources needed to address these persistent and deadly health disparities. Public health is a vital resource to the safety and wellness of our community with a focus on providing fairness and equity. We have to give our community access to the resources to live healthy lifestyles. When we do that, public health can save lives. That's exactly what the Jackson County Health Department has sacrificed so much to achieve over 20 long months and counting. Together, we have made many tough decisions, but each and every one of those decisions have been guided by science. We trust in the science, and that would not change as we face more challenges ahead. I commend Health Director Bridget Schaefer and her dedicated team for fighting through the uncertainty, negativity, and criticism with dignity, grace, and respect. I'm honored to stand with you and do what's right for the health and safety of our community. CARES Act dollars have allowed our public health professionals to educate us, to test us, and now vaccinate us against this virus. Efforts to get folks to roll up their sleeves began with the health department's first vaccine clinic in January. In line with the state's distribution plan, we targeted our healthcare workers, nursing home staff, and residents. Thousands more joined us at a 2-day mass vaccination event at the Truman Sports Complex. The county health department worked in coordination with various local and state partners to administer shots to 8,000 people, exceeding all expectations. We have made great progress getting more of our community vaccinated. It is the best tool we have to getting back to normal life. That's what we all want, to feel like life is normal again. A big step toward that is upon us. Children ages 5 to 11 can now get vaccinated. We can finally protect the last of our most vulnerable populations from this deadly virus. And our health department is ready to do the work by holding clinics inside and outside of schools. I must say that our education leaders have been tremendous partners during these uncertain times. We have met regularly for over a year with Jackson County school superintendents to discuss the status of COVID-19 and our collective response. Thank you for your willingness to work together to find the healthiest and safest path forward for students and families and staff. Public health has always been critical to our overall well-being. But for many, it unfortunately took a global pandemic to realize it. Public health is our most effective tool for building a more equitable health system. In order to do that, we must invest so we can create stronger systems, programs, and practices. The Jackson County Health Department will lead this charge from a new building in Lee Summit. This facility will be renovated with modern amenities to continue our public health response to COVID-19, as well as improve operations and enhance the wellness programming. While many of us are fortunate to have access to quality health insurance and the financial means to pay for care, far too many do not. That is why I'm so grateful that our community has one of the most effective safety net hospitals in the country. University Health has been leading our region's response to the COVID-19 virus from the very beginning, taking action to protect their employees and our community from this deadly disease. I'm grateful for their work, and I'm honored to welcome the CEO, Charlie Shields, to tell you more about University Health's response to this deadly pandemic and their role in our community.
So the relationship with Jackson County goes back really to the creation of Truman Medical Centers back in the early 70s, when county leaders said that this community needs an organization that will serve not only as an academic medical center, but as an essential hospital for those that have the best insurance or have no insurance at all. Yeah, so one of the things that we realized early on in the pandemic is we were limited in our ability to put patients in isolation rooms. We just didn't have very many of them because nobody had thought, that you would have a pandemic of this scope and you'd need those kind of isolation rooms. So the county, through the CARES Act funding and how they chose to invest that, we were able to add significant amounts of isolation rooms all across the organization, not just in the Truman Medical Center downtown campus, but also in the Lakewood Medical Center campus out east. So we added isolation rooms, and then when we got to the second wave, the Delta variant, every one of those rooms was full. So it was a good investment, and it paid off. It showed that we were ready to deal with the next wave, and because of the county's forethought, we were able to do that in great form. So clearly, we knew that for us to be effective in increasing vaccination rates, it had to be more than just doing vaccination at the two hospitals. We had to be out in the community. So one of the investments was 2 mobile units that enabled us to go out to community centers, to churches, to other places where folks gather in this community, where access, to vaccination would be much easier than trying to come down to one of the 2 hospitals. So I visited a number of those sites as we were doing those vaccination clinics, using that equipment, using those buses to be able to do that. Talking to folks, they were grateful that we were in their neighborhoods, able to give them something without having to come to the hospital. For some, coming to the hospital is inconvenience. For some, it's much more than inconvenience because they didn't have transportation. So being out in the community was very important. Those buses enabled us to do that. So a lot of folks in county government have been extremely helpful. First and foremost, our county executive, Frank White, who got it from day one, knew the challenges of the pandemic, knew what it was going to take. Even when it comes to vaccination, both Frank and his wife, Teresa, were one of the first to receive their vaccinations, sending the message that this is important for us to get past the pandemic. But past Frank, the county legislature, we met with the county legislature on multiple occasions. You could not have a group of people that are more committed to helping this county, this community get past the pandemic. It's really been a great partnership. There's great leadership at the county level, both with the county executive and the legislature. They've been wonderful partners for University Health. It's a relationship that has gone back decades and will continue decades to come. So we're thankful for that partnership.
Speeches like this gives us an opportunity to do a few things. They allow us to look back to see where we have come from. They allow us to show where we are today. And most importantly, provide a picture of who we could be. So who are we? Where are we? As we look back, we see that Jackson County has achieved many great things throughout our history. Our predecessors created an amazing safety net hospital system. They developed and grew some of the finest parks in the country. And they built two of the greatest sports stadiums in the world. But Jackson County has also faced its share of obstacles. In those tough times, when resources were scarce and needs were great, our predecessors were often forced to choose between the best of only bad choices. Time and time again, when dollars were short, decisions were made that put off the regular maintenance and necessary improvements to our facilities. It also delayed salary increases and support for our associates, and failed to properly invest for our county's future. Unfortunately, when finances improved, the county did not go back and make up those cuts. And while we can argue about how bad their decisions were or complain about the county we inherited, we cannot go back and change history. Instead, I believe it is our job and it is my commitment to build a better, a more equitable Jackson County. That is why when I think back to the day I took office as county executive, I'm so proud of what we have been able to accomplish in a short amount of time. In 2016, we had our share of things that were shiny, that were new and exciting. But we also had serious issues that had grown over time and could not be ignored. We had essential facilities that were aging, high staff turnover, and unaffordable health care premiums. I am proud to say that this is no longer the case. With the support of the county legislature, we have made great strides on all of these serious issues. Arguably, the county's most historic and important facility, the downtown Kansas City Courthouse, is now nearly 90 years old. It remains as beautiful and iconic as the day it was built. But it is clear that the costly and inconvenient failures we have recently faced will only increase unless we make substantial investments in this community landmark. For example, the elevators originally to the building have been renovated. They're new, fast, and convenient. Each one is in good working condition. We also focus on our associates. On February 10th, 2020, the legislature approved a contract to conduct the first compensation study in at least 10 years for our staff. When the study was completed, we received a report that told us what we had long suspected. Jackson County associates were embarrassingly underpaid for the work they were doing. And at that time, in fact, nearly half of all county associates were making less than what has commonly been referred to as a living wage, or $15 an hour. The solution was not cheap, and it would not be easy to implement. But it is clear that we needed to step up and do the right thing by our associates. and I'm happy to say that we have. I would like to thank former Legislative Chair Teresa Galvin for her partnership, support, and hard work that helped turn this compensation study into reality. Despite the significant costs and complexity, Legislator Galvin has never wavered in her commitment to this effort, and for that, I will always be grateful. And I'm proud to announce that every county associate is now making at least $15 an hour. We were able to achieve this ambitious goal on budget and ahead of schedule. Supporting our associates doesn't stop with their pay. We expanded our paid parental leave policy. We more than doubled our prior policy and now offer all county associates 12 weeks of fully paid parental leave, the most progressive policy in Missouri. Our policy treats mothers and fathers equally, does not discriminate based on sexual orientation, and applies to adoptive parents as well. We did this because it was the right thing to do, because we wanted to set an example for others to follow, and because families come first in Jackson County. Additionally, our annual budgets have consistently prioritized our investment in the county's pension plan. Many county associates will spend their entire adult lives working for Jackson County. And in exchange for their lifetime of public service, we promise them a modest but important pension to help support them and the loved ones in their retirement. Far too often, we read stories about pension plans being dangerously underfunded, benefits reduced, or in some cases, going bankrupt. My heart breaks every time I think about hardworking men and women who can't provide for themselves because the pensions they were promised were gone before they needed them. I refuse to let that happen on my watch. And I'm happy to say a very different story is happening in Jackson County. When I took office, our pension plan was underfunded, but not on the brink of imminent collapse. Not a crisis or a celebration. We could have easily lost sight of this very important issue. Instead, we've made unprecedented investments in our plan. And we've been able to do that without reducing benefits and providing consistent cost of living increases for our retirees. That prudent management has led to our pension funding going from 76% funded when I first took office to now over 90% funded, with the real possibility of 100% funding by the end of 2022. That is building a better and more equitable Jackson County. Jackson County is home to the third largest county park system in the country. Under the passionate and dedicated leadership of Director Michelle Newman, our Parks Plus Rec department welcomes more than 1 million visitors every year. While we are familiar with hearing visitors comment about how beautiful our parks are, the friendliness of our staff, or the variety of fun options available, those compliments have changed in a powerful way. Our parks have always been a place where fun happens and lifetime memories are made. But in a world shaped by COVID-19, the parks transformed into something totally magical. When parents couldn't take any more of the frustration that comes with remote learning, they could hop in a car and drive to a playground for their kids to burn some energy and get some fresh air. When work from home turned into faulty meeting links, technical issues, and frustration, people were able to take a walk on the trail or just skip rocks on the lake. Our parks are magical. They provide us a place to get away and also a place to remind us that we are not alone. One of my proudest achievements as county executive was creating a Kids to the Park program. The idea was simple. Our parks are amazing and beautiful, but that doesn't matter unless people know about them and can get to them. To overcome those obstacles, our Parks Department works with community partners who serves kids in areas of the county who have historically not taken advantage of all that our parks have to offer. We provide free transportation and admission, and our staff puts together an experience they won't soon forget. Here are some of my friends who can tell you more about it.
People can just say, be at the park. They don't have to roll out the red carpet for you. They chartered a bus that took us out there and met Frank White. He met the kids. It was a wonderful time. I think the first trip we took was the beach. The kids had a ball running out into the water and swimming and just enjoying that moment. Most of them had never, ever been to a beach. Definitely all of them probably had never been to that particular beach.
We don't really have a lot of money, so we don't really go places, you know. Hi, my name is Zoe. I am 12 years old. I love spending time with friends, and I like making friends, and I like being around people that I love and care about, so this is a great place to do it.
Experience, opportunities. I think that's what Boys and Girls Club is about, is trying to find more opportunities for our kids to have lifelong experiences.
So we got on a boat that a pirate was driving. We drove off into the lake, and they gave us some treasure at the docks and told us to keep hold of it in case any pirates came to try and take it.
Then they anchored the boats together, and they were walking across the boats. Where's the treasure? And all this craziness.
And we had to basically play hot potato with it behind our backs. It was really fun. I felt like I did a really good job personally with hiding it.
It was dramatic. It was educational. It was fun. Sometimes things are just like a hidden secret, and it shouldn't be. And I think that Jackson County is definitely doing that. They really care. I can tell.
It makes me feel like I deserve to be a part of something like this. Just thank you in general for just caring enough to help out with this for kids who might not have ever experienced this without the program. So yeah, just thank you.
Building a better Jackson County means bringing communities together. And the county had a vision to revitalize and energize our community in a way we have never seen before, by transforming an old railroad corridor into a recreational destination. Earlier this summer, that vision came to life. We proudly opened Phase 2 of the Rock Island Trail. Combined with Phase 1, which opened in June 2019, the entire trail is 13.5 miles long. With completion of the Rock Island Trail, Jackson County has more than 150 miles of trails in this park system. Visitors enjoy an experience like no other on the Rock Island. They can stop in one of the many cities along the way to shop, to eat, and relax. My wife Teresa and I can even ride our bikes all the way from our home in Lee Summit to a game at the Truman Sports Complex. But I think we'll leave that up to the cyclists, like legislator Tony Miller, who didn't let a little bit of rain and mud stop him from riding the trail on the day of the ribbon cutting. It shows that Tony is a passionate park advocate and regular trail user. I appreciate the support he has given on this project and many others to keep our park system a premier resource for relaxation, reflection, and rejuvenation for everyone. Park systems across the country provide environmental, social, and economic benefits we need to thrive as a society. And our crown jewel, right here in the heart of America, is no different. So what will we make of this moment? Will we allow the challenges we face to stop our progress? Or will we use them to make meaningful change? My priority is to use this as an opportunity to build a better, more equitable Jackson County, and our 2022 budget lays out our roadmap for the future. We are focused on improving the customer experience by investing in our associates and updating the technology they rely on to deliver services. Our new multi-million-dollar assessment system is scheduled to go live in 2022. And I've included funding to upgrade our tax collection system at the same time to ensure the process is easy for taxpayers and their information is secure. These investments will dramatically transform how we assess and collect taxes on the more than 300,000 properties in the county. When coupled with the leadership of County Assessor Gail McCain-Beatty and her team of associates, these investments will help to ensure we're valuing all properties accurately, equitably, and fairly. Funding in my recommended budget will also allow us to make it easier to do business with the county. This includes streamlining our bid processes and putting them online so anyone can view, monitor, and submit, regardless of where they're from or the size of their company. This will also make it easier for small businesses, including minority and women-owned businesses, to compete on a level playing field as we work to make sure our contractors adequately and appropriately reflect the community we serve. In addition, we're buying state-of-the-art software to manage our public records, making it cheaper, easier, and more convenient for the public to access information and records they have a right to see. My budget also invests in our associates. It implements the third and final year of our compensation study, ensuring our associates will make salaries at or above their peers in the market. We must continue with these efforts if we want to attract new talent, retain them, and support their growth. Our associates work hard, and we need them. We need their institutional knowledge and their passion if we truly want to build a better and more equitable Jackson County. In 2022, we're expanding our health benefits package without a significant increase to health care premiums. For the first time, we're offering comprehensive coverage for infertility treatments and gender-affirming care. On top of that, my proposed budget also affords each department the ability to expand professional development training and tuition reimbursement. Friends, the state of the county is getting stronger. We're getting the work done. But if we want to continue our progress, it will take all of us. We cannot be complacent. We cannot be satisfied. We cannot forget why we are here, to build a better, more equitable Jackson County. Our children and grandchildren are depending on us. They deserve to live in a community where having women at the decision-making table is the norm, not the exception. They deserve to live in a community where the first Black person elected to office is something they read about in their history books, not as breaking news. They deserve to live in a community where public servants are respected and receive an honest day's pay for an honest day's work. They deserve to live in a community where your outcome in life is not determined by the zip code where you were born, the color of your skin, or the balance of your savings account. This is the future we're building. A better, more equitable Jackson County. The work may get hard. The rewards will be nothing short of amazing. I look forward to working with you as we embark on this momentous journey together. May God bless you, your family, and this great county. Thank you.